Hi, I'm Ward Sparacchio, Director of Commercial Innovation for GE Healthcare. Thanks for joining our webinar today. We hope this education session will deliver to you the knowledge that you need to enhance the utilization of ultrasound in your practice. Our presenter today, Dr. Stella Dezyatnikova, has over 20 years' experience in facial plastic surgery and aesthetic medicine. She is also a member of the American Institute of Ultrasound and Medicine and the American Academy of Facial Plastic and Reconstructive Surgery. Dr. Stella is dual board certified in facial plastic reconstructive surgery and otolaryngology. She's also the founder of the Stella Center and the Ultrasonos Ultrasound Training Institute, both located in Seattle, Washington. Dr. Stella is a paid consultant for GE Healthcare and is not endorsing our products or the company in any way. If you have any technical challenges with this webinar, please put your questions or technical issues in the chat window on your screen. A representative will get back to you. Thanks again for joining our webinar, Introduction to Ultrasound in Aesthetic Medicine. Now I'll turn it over to Dr. Stella.
Good afternoon, everyone. It is truly my pleasure today to talk to you about using ultrasound for aesthetic medicine. And in particular today we will cover the Vscan applications, which is a handheld portable device. So I'm a facial plastic surgeon in Seattle, Washington, as Ward said, and I've been in aesthetics and in facial plastic surgery for over 20 years. And I've been using ultrasound for the last several years, and I have become really passionate about using ultrasound for safety and for precision of our treatments. So what we're going to cover today, we're going to talk about why we use ultrasound, why we should use ultrasound. I like to divide it into the beginner and advanced applications, and I will tell you what I mean by those. Then we'll talk a little bit about one of the most important applications, which I think is really important for the beginners and for those of us doing the aesthetic treatments to prevent the complications, and this is vascular mapping. And then I will cover the anatomy of some high-risk areas, and we'll do the live scanning. And in particular, we're going to cover the piriform space, temporal fossa, chin, and jawline. Today, we're going to be talking about use of ultrasound in aesthetic medicine. And as you all know, it became really popular in the last several years. And probably one of the biggest reasons why it became so popular is that we now have the devices, which are those handheld, portable devices, and they became available and affordable for individual practitioners to bring them into their practices, and then they can use them to treat their patients and to prevent and avoid complications. So ultrasound by itself that we're talking about today, it's an imaging modality. So we use those devices to see the patient's anatomy, see different tissues, existing fillers, implants. Ultrasound is not going to be used to treat, as opposed to other devices that actually have ultrasound used for therapeutic applications. In our case, again, it's going to be the imaging modality, which is really invaluable because for the first time we can actually see what we can treat for our patients. We can see individual patient's anatomy, and there's really no replacement for this kind of individual anatomy that we can see. So we can direct our treatment, make them more safe. We can place fillers, threads, and other applications, toxins, in a more precise manner in the tissue layer that exactly we need to treat. And then, of course, we can use these devices to direct our treatment of complications by visualizing, again, where the complications occur, and using our devices to treat them in an ultrasound-guided or directed fashion. So the beginner applications for somebody who is just starting with ultrasound, who is bringing the device into their practice, one is the vascular mapping for the high-risk areas, and we'll cover some of those areas later today. In particular, we'll talk about the piriform space, temples, chin, jawline. Those are the areas that are particularly prone to having a vascular occlusion complication, meaning getting filler in the artery, and in the worst case scenario, developing blindness. stroke, and other vascular occlusion complications. So using ultrasound in this case is really helpful for us to find the vessels so that we can avoid them during treatment. We can also use it to diagnose any anatomical abnormalities, surgical changes, to see if the patients have prior fillers, which will make our treatment plan perhaps unfortunate, or will need to be changed, or patients had any implants, which a lot of times they will forget to tell you, or they don't want to tell you, and again that can modify our treatment plan. And then of course the treatment of vascular occlusion, even though it's a more complicated process, but I like to classify it as the beginner applications because this is the one that is basically one of the biggest reasons that the practitioners bring ultrasound in their practices, and that will be the one that they will probably be using it for. And then for more advanced use, we have things like ultrasound-guided injections of hyaluronidase to treat delayed onset nodules, filler malposition, or the vascular occlusion itself. And then, of course, we can use the ultrasound-guided method for filler placement, such as placing it in the temples, piriform, and some other areas in the face, and even high risk, such as glabella, forehead, and nose. So I will just cover a little bit the tissue recognition on ultrasound, because each tissue has its certain echogenicity, meaning how dark or how light it appears on our screen. And something that will be very dark or black, or we call it anechoic, will usually be fluid, water, blood, or our hyaluronic acid gel or ultrasound gel. And then we have something that's hypoechoic, that is still very dark with a high content of water, which will be muscle or older hyaluronic acid gel, or something that will be very loose tissue, such as a loose fat, usually superficial fat. And then, of course, on the opposite end of the spectrum, we have the hyperechoic tissues, which will be appearing white on our screen. And usually it will be bone, dense areas of the fascia. Epidermis appears white due to reflection of the ultrasound waves. Calcium deposits, such as our Caja filler, and metal, such as our needles and cannulas. So what I like to do for my students, I like to introduce color for the images, and I actually do it by hand. So I color the images, and then I superimpose it, and that makes it a lot easier for my students, especially when they're beginners, to learn. Because one of the biggest complaints that people have when they just start introducing the ultrasound into their practice is that they really don't know what they're looking at. And having this little anatomical diagram really helps them identify at least some tissues and anatomical structures, and will make it much easier for them to progress in their training. So in this case, we have an image through the midface, and it's a sagittal image, vertical sagittal image. And you have the little avatar of the face. So I will always place either an avatar like this or a photo that will show you the position of the probe, because otherwise it can be very difficult to tell where in the face you are or how your probe is positioned. So again, sagittal image of the face, the top of the probe, which corresponds to the left side of your image, is located close to the patient eyeball, going down toward the corner of the mouth. So as we look on the image, I put the muscles in red, so we can see the orbicularis oculi and the levator labii superioris muscles. And then above it we have the superficial fat, and below it we have the deep fat in the cheek, and those are both hypoechoic. We have the hyperechoic line of bone, and on top we have the hyperechoic line of epidermis. On the very top we have the anechoic ultrasound gel, And by the patient's eyeball, we have the hyperechoic orbital fat, which is slightly more hyperechoic in this area. And now we're going to talk about the vascular mapping. So vascular mapping will be the application that will be probably one of the most important for the people who introduce the ultrasound into their practices. And even for experts, this is something that will be particularly useful. So basically what it means finding the blood vessels in the area that we want to inject or we have injected, making sure that we can stay away from the risky areas, to modify our plan of treatment if necessary, or to reinforce our plan of treatment. So Vscan is particularly adept at finding the blood vessels, so it makes it very easy for the beginners to use this device and find the blood vessels. And as we do some scanning later on today, I will show you that you can use the two settings, and then there's a fast flow and a slow flow settings. And for really, really tiny blood vessels, using the slow flow make it even easier. So let's start with something that's considered to be a fairly beginner area, which is piriform space or the top of the nasolabial fold. And you can see on the video the position of my probe again. It is positioned perpendicular and at the top of the nasolabial fold, perpendicular to the fold and perpendicular to the angular artery. And you can see it can catch the artery in the cross section, and here it is pulsating. So here's a diagram of the space, and you can see the muscles in red, or they are hypoechoic on the screen. And then we have the cheek fat and the deep fat, and they're shown in yellow. And then, of course, we have the epidermis, dermis, our ultrasound gel, and layer of the bone below. Here's a different orientation for the same area. This is also the piriform space, but our probe is oriented along the artery. And you can see it on the diagram as well. You can see that it's catching the LL-SAM muscle, again oriented along the muscle in this case, and it's catching the deep and superficial links of this angular artery, which is especially important for us to know to avoid placing filler in that deep part of the artery. So now we're going to go and do some live scanning, and you have a orientation that will make it easier for you to understand what I'm doing. So once you get the probe, make sure that you know where your marker is, and usually we want to orient the marker so that it corresponds to the left side of your screen, and it will correspond to the right side or the top, the cranial part of the patient's face. We're going to start with our lovely patient, Whitney, and she agreed to be our model today so that we can show you how to do scanning of different areas in the face, including mostly the high-risk areas. So we're going to start with the live scanning of the piriform aperture. And before we start scanning, one thing to remember, make sure that you always know where your probe marker is. And then in this case, it's right here. And then another thing is to remember that we will always be using a lot of ultrasound gel on the face, and we'll be using very light pressure. So let's start with the piriform area. And go ahead and close your eyes. So if you guys remember, and everybody tells you that anatomy is variable, and then you never know where that artery is. So the thing that I like the most about ultrasound is that you will know exactly where that artery is, and it will just take you several seconds of your time. Of course, you need to know the anatomy, you need to know what vessels you're looking for, you need to know that they can be in variable position, variable depth, but you can put your device right on top of it, and then you can see exactly where it is. And here's that angular artery. And I can compress the tissue a little bit. And now you can see it pulsating. So that was kind of mid-depth between the epidermis and the bone. And of course, we're planning to inject on the bone, that's the area that we need to interrogate. Here's another good image of the artery. And now that we are looking for that deeper area, we can see that she actually has some deeper areas right where you would normally want to inject. So that is under the LL muscle, on the bone, her piriform space. She has some deeper branches. So I would be super careful injecting somebody like her. On the bone. And I would probably change my treatment plan and either inject more superficial, or if I want to inject the deeper area still, I would inject it ultrasound guided. And now that we have done some scanning in the piriform area, we're going to cover the temple. So temple is a particularly high risk area again. And when I'm talking about high risk, it's usually something that is the vascular occlusion, getting fill in the temple, and in the worst case scenario is blindness. So using ultrasound to help us identify those vessels and staying away from them is something that's particularly useful. Temple anatomy is very complicated, and actually it can show beautifully on ultrasound, and ultrasound really helps you to understand all the layers, not only in the temple but also in the other parts of the face. So for example, here we have again the image of the temple. My probe is positioned diagonally, and that's my preferred position of the probe in the temple. So we have the top of the probe positioned toward the patient's forehead, and it corresponds to the left side of the image that you see. So the layers that we can identify here, starting from the bottom, we have the bone, which is a hyperechoic white line. Then we have the hypoechoic muscle, which is our temporalis muscle, with layers of fascia. Those are hyperechoic lines. And you can see that this patient had a bunch of temple filler, and the filler is anechoic. And I marked it in blue for ease of understanding. So then we have a wedge of this intermediate temporal fat pad, which is marked in yellow, layers of deep temporal fascia that surround it, and then in pink I mark the superficial temporal fascia. In between those two layers is the interfascial layer, which we also know as layer 4, which is one of the preferred places to put the filler in the temple. And then again, going further up, we have the superficial fat, dermis and epidermis. You can see on this image that there's 2 blood vessels, and you can see later in the video that it is a vein. We see the middle temporal vein, which is a lot of time easier to find in this intermediate temporal fat pad, and then it connects to the superficial temporal vein. So because the anatomy is complicated and I teach my students those ultrasound-guided injections, here's an image out of my paper on ultrasound-guided temple filler injections, which goes over these layers again in details. And here's a video of the same area. So what you can see on the video is that the vessels, they're kind of floaty, they're like lakes, they're not really pulsating, which usually corresponds to veins. We can also sometimes push a little bit with a probe in the tissue, and the veins will be easily compressible. So now we're going to do some live scanning of the temporal fossa and show you the layers and arteries. Okay, we're going to check out her temple now. So as you guys know, temple is a very high risk area for fillers. And we like to do this on the bone injection, which I still do quite a bit. The one that's also named one up and over, or supraperiosteal injection. So checking for the anatomy of the area again first, we can see the really nice anatomy of the temple layers. You see the bone, you see the hypoechoic muscle above it. Here's her little wedge of intermediate temporal fat. And then we see kind of combination of fascial layers on the top, and then dermis and epidermis, layer of ultrasound gel on the top. So what I like to do when I inject the temple and I want to inject on the bone, first I would mark, or I would kind of eyeball the area that I want to inject, and then I place the position of the center of my foot plate right on that area. So let's check for the vessels. So here we have our little color box. So if we're looking for the vessels on the bone, then I want to make sure that the color box will actually encompass that bone layer, which is not doing that now. So let's bring it all the way down here. And that kind of all looks good. But as I go further toward the forehead, you saw that little flash. And here's that deep artery. So we need to remember the deep arteries are always there. What we just want to make sure that they're away from our needle tip. So here it is. Gives you this nice image of the artery. So you just want to make sure that you don't inject there. So that's what you would normally do. You would just kind of interrogate the whole area. Part of the reason that you want to check the whole area is because we never can be exactly sure where the tip of your needle will be, especially when it has to go for a couple of centimeters, 2-3 centimeters deep. So we want to make sure that that whole area is safe for you, even though obviously you will try to align your needle and your syringe with the direction of the probe itself. We want to check for superficial vessels. So if we want to check for superficial vessels, again, we want to make sure that the color box covers the superficial layers. So let's see what we have here. You can still see the deeper vessels. A lot of times you can find superficial vessels closer to the hairline, toward the back. And you can see I'm just kind of slowly advancing my probe toward the area that I think the vessels are. And at some point you will usually find them. A lot of times it will be way back. So here we can see a branch. Again, I'm right by the hairline, kind of like right where I thought the artery was. And here's a little tiny cross section of the superficial temporal artery. You can see it's pulsating on the screen. And it's in between the layers of the superficial temporal fascia. And here's another branch. So the reason that we want to avoid those superficial temporal vessels, other than the fact that they obviously can be connected through the forehead, they can be connected to the ophthalmic circulation, to your supratrochlear, supraorbital vessels, but also as they supply the blood supply toward the scalp. The incidences of vascular occlusion in these vessels are now reported quite frequently, and they can actually lead to patients losing their hair or alopecia and scarring in their scalp. And then sometimes we can find that middle temporal vein that I showed you earlier. During my presentation, it's usually easier to find in the intermediate temporal fat, and it is this wedge of the fat kind of right in the middle of the screen. It's a hypoechoic wedge-like structure with a bunch of hyperechoic fascial layers in between. And here's that middle temporal vein right here. And now that we have done that, we will cover the chin and the jawline, which recently has become one of the most common sites of vascular occlusion. So I think using the ultrasound can help us prevent a lot of those complications. So starting from the back of the jawline, let's look over the layers. In the middle we have this hyperechoic bone, and then large masseter muscle, which also is hyperechoic, with small fascial strands in it. Then we have a thick layer of SMAS and parotid and mesenteric fascia in the middle. And above it we have the superficial fat, dermis and epidermis. In front of the masseter, you can see the facial artery. Facial vein is right there as well. There in this deep layer of the fat, which is a buccal fat pad. And as we go forward in the face, we'll see the buccinator muscle and the deeper fat in the chin. So what we can see here on the video, the muscle in the middle of the screen is your DAO muscle, depressor anguli oris, and we can see the facial artery pulsating right at the lateral portion of this muscle. And below it, of course, we see the bone, and in between the bone and DAO is our DLI, or depressor labii inferioris muscle. As we go further forward in the chin, we will see several other arteries. Here's an image of the inferior labial artery, which is oriented along the probe in this case. Mental artery, a lot of times we can find deep on the bone, the mental foramen. In this case, again, it's deep to the DAO muscle and right on the bone. As we go toward the middle of the chin, which is a common area for filler placement, we see two dark hypoechoic bellies of the mentalis muscle, and we see a branch of the submental artery. And this is the artery that frequently gets into complication situations. So now we're going to do some live scanning of the chin and jawline on our model. So let's scan the area of the jaw and the chin. So the jaw is a very popular area for filler injections now, as you all know. And this is the area where we can get in trouble with a really large facial artery and vein. Frequent area for occlusions. So let's put some ultrasound gel. Again, remember, we need to use a lot of ultrasound gel when we do the facial scanning. And let's appreciate the general anatomy of the area. And then look for the vessels. So first I'm checking for my marker. My marker is on the right side of the patient. And in this case, it will correspond to the left side of your screen. We can see the bone. We can see the large hypoechoic masseter muscle. And then we can see in front of it the pulsating artery, which again you can appreciate without even putting the color box. So to confirm, we'll just put the color box on it, and then you can see we have the two pulsating structures. And I'll just make it just a little bit bigger. So usually what we have the artery and the vein that cross the mandible here in front of the masseter. And if we put some pressure on the probe now, we usually can compress the vein, and the artery that stays and pulsates, or the vessel, that will be the artery. And if we relieve the pressure, we see the vein. So if you remember also, the blue and red color doesn't indicate the artery and vein. It just shows us the direction of the flow toward or away. So in this case, we see the artery is mostly in blue and the vein is actually in red. And then there in this deep layer of the fat in front of the masseter, which is a buccal fat, and then that's sitting on top of this hypoechoic layer that shows as a darker stripe, and that's our buccinator muscle. Again, if we compress the vein, but the artery will still show. If now we go forward and follow it toward the patient's chin, we start seeing the DAO muscle, and it's this dark hypoechoic linear structure, which is usually very easy to find. And let's look at the vessels again. So here you can see this kind of large kink of the artery. And if I put just a little bit of pressure on the tissue, you can see that it's pulsating. So that's a kink of the facial artery. And then we can move our color box a little bit. And then this way we can appreciate a little bit better. As we go forward again, we see the DAO muscle, and underneath or deeper, closer to the bone, we see the DLI or depressor labii inferioris muscle. We see this opening through the bone, which we want to check if that's the mental foramen. So there's just a little bit of a flow, and then another thing we can do, we can steer our color box a little bit, and that can help you find the vessels a little bit better sometimes. And as we go forward toward the chin, we're going to be looking for other vascular structures. So one thing that you want to make sure that your probe is really stable. So you can see I usually stabilize it to the patient face by basically stabilizing my hand. And you can see if I put a little bit of pressure on the tissue, it's really easy to occlude those little tiny facial vessels, so make sure that you don't put a lot of pressure on the tissue. So now that we have discussed the little technical details, we can start looking for those vessels again. So now we can find the inferior labial, or sometimes it can be labiamental, or sometimes it can be both in some patients' arteries. Basically branches from the facial artery that go toward the lower lip and toward the chin. A lot of times there will be an artery in that labiamental sulcus. And here's that little bit of the mental foramen that we were just catching, so I'm just going to show it to you right here. And you can see the opening through the bone and the small little splashes of blue, and that is the mental artery. Okay, so since we usually start the filler injection in the center for the chin, that's the area that we want to scan for blood vessels. And again, I can see a couple of very small dark dots, and those usually will correspond to the blood vessels. So if we want to confirm, of course, we'll turn our color on. And then we can turn to the slow flow and see if any of them are little tiny veins. And you can see here's one. This is more superficial vessels in subcutaneous fat. Most of the time we will start our injections deep on the bone, so that's the area that we want to interrogate for blood vessels. So let's go to that. So here we are in the middle of the chin. And of course we want to avoid injecting any areas that have the blood vessels in it. We're looking for those two branches of the submental vessels that come off of the facial artery on the right and on the left. And here's a couple of little ones that we can actually see. And of course, those are the areas that we want to avoid injecting. And if you plan on injecting right at the border of the mandible, so this is the area that you want to check. And here you can see there's not a lot of tissue, it's fairly superficial. And you can see this vessel, and in this case, it's on the patient's left, which means it's on the right side of your screen. And here's a little branch of the submental artery. So now that you have checked that, looks like the center looks good. Looks like actually the right side, patient's right side, meaning the left side of your screen, looks good. And then if we get close to this area that has a little submental artery here, then that's the area that we want to be careful. A lot of time, chin injection will include the pre-jowl and the labiomental sulcus. So if you're planning to do any deep or superficial injections, again, just kind of trying to keep yourself out of trouble. Here we see two vessels, really superficial. They're in the subdermal plane. And now you can see them really well. If I want to know where they are on the patient, I will position them in the middle of the screen. And then I know that this is the area that will correspond to the middle of my foot plate, and I can see on my patient exactly where it is. Right here. A lot of times it's a good idea to check the labiomental sulcus in general. That's the area that the vessels can run fairly superficial. And this is the area that we frequently inject with cannula in the subdermal plane. So using some caution in this area is advisable. And in the pre-jowl sulcus, that's where we usually see this little guy. So branch of the facial artery itself. You can see in the middle it's large hypoechoic muscle, which is the DAO muscle. And deeper, you can see the white hyperechoic teeth. And above the surface of the bone, and the deeper artery in this case is likely the branch of the mental artery. And sometimes it could be a branch of the facial artery. To really know, you have to follow them. And a lot of times you don't need to follow them, you just want to make sure that you are safe in the area that you're injecting. So the other muscle under the DAO, that's your DLI muscle. And you can see some arterial branches right through that muscle. And here we can see the horizontal branch on top of the DAO muscle, and that is likely her inferior labial artery. And now that we have done some live scanning, basically we just want to recap what we're talking about before. And the most important role that I see for ultrasound in our practice is really the prevention of complications, such as prevention of vascular occlusion and prevention of delayed complication. And it can help us by finding the blood vessels, staying away from them, and also making sure that we position our filler in the precise plane that we're planning to position. So doing this anatomical mapping prior to injection can be very fast and can be really beneficial. We can also find the old fillers. A lot of times finding the old fillers for the patients can help prevent further situations such as creating the delayed onset nodules. And then, of course, we use the ultrasound to treat complications, such as treat the vascular occlusion and treating those delayed onset nodules.
And we have reached the end of today's webinar, Master Your Skills, Ultrasound in Aesthetic Medicine. Thank you for attending. If you have any questions, please feel free to type them in the Q&A box on your screen, and a representative will follow up with you. We appreciate your time and hope you found this informative. We'll look forward to seeing you again in a future presentation.